To date, there have been more than 31 million documented cases of COVID-19 infections, and more than 500,000 COVID-19 related deaths in the United States. Now, more than 1 year into the pandemic, we've reached a major development with the arrival of COVID-19 vaccines. Currently, more than 70 million U.S. residents have been fully vaccinated, with more anticipated as vaccines continue to roll out across the country. However, some remain hesitant about getting vaccinated due to concerns about potential side effects, vaccine effectiveness, a lack of information or misinformation, and historical distrust of the medical community and government. The practice of immunization dates back hundreds of years. Thanks to vaccines, we've been able to eradicate or minimize the effects of many diseases, including polio, measles, mumps, and smallpox. Some of these infections that spread like the COVID-19 pandemic are no longer seen thanks to widespread immunization. When the COVID-19 virus enters your body, like other germs, it attacks and multiplies, resulting in infection. The COVID-19 vaccine helps you develop immunity by aiding your immune system in recognizing and fighting the virus. This protects you from getting sick. COVID-19 vaccines are safe and effective. The United States' long-standing vaccine safety system ensures that vaccines are as safe as possible. The COVID-19 vaccines are held to the same safety standards as all other vaccines and will undergo the most intensive safety monitoring in U.S. history. The vaccines met the Food and Drug Administration's rigorous scientific standards for safety, effectiveness, and manufacturing quality needed to support emergency use authorization. How long the vaccine will protect you and whether a booster dose will be needed in the future, as with some other vaccines, is not yet known. Researchers continue to collect data on the vaccine's long-term benefits to answer these questions. Right now, it is important to get as many people as possible protected with the vaccines. As with any vaccine, some people may experience side effects, including swelling, redness, and pain at the injection site, fever, headache, fatigue, muscle pain, chills, and nausea. These short-term reactions are more common following the second vaccination and may vary in intensity. Severe reactions are rare. Experiencing side effects does not mean you are sick. It's your body's way of showing that it is producing antibodies against the virus. So far, studies have shown that vaccines are effective at preventing you from being infected with the COVID-19 virus and some variants. However, if you do become infected with COVID-19 when you're fully vaccinated, the vaccine will also help keep you from experiencing severe symptoms. This added boost to your immune system will help you avoid hospitalization or death. The CDC recently announced new guidance for masking for individuals who have been vaccinated, which says, if you are fully vaccinated, you can resume activities you did prior to the pandemic. If you are fully vaccinated, you can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. Visit the CDC website for the most current and complete guidance on masking. Although vaccines are effective at keeping you from getting seriously sick, scientists are still learning how effective the vaccines are against variants of the virus that cause COVID-19. Early data show that vaccines may work against some variants, but could be less effective against others. We're also still learning how long COVID-19 vaccines can protect people, and how well the vaccines protect people with weakened immune systems, including people who take immunosuppressive medications. As soon as you are able, please consider getting a COVID-19 vaccine. If you are unsure whether you can take the vaccine, ask your doctor or healthcare provider. Also encourage others to get vaccinated too. Together we can bring an end to this pandemic. For the latest information on COVID-19 vaccines, visit the Center for Disease Control and Prevention website, the U.S. Food and Drug Administration website, and the ATS COVID-19 vaccine resources page of the website.